Hi, this is Dr. Lili, and today I want to talk to you about why you should keep your newborn at home.
When the doctor says my child has a condition, I'll learn more at my pocket pediatrician.
Hi, this is Dr. Lili, and today I want to talk to you about why you should keep your newborn baby at home. When you first have that newborn baby, you've been waiting for 9 months or so for this baby, maybe a lot longer. Maybe this baby was a surprise, but either way, all of a sudden this baby is out and you're meeting him or her for the first time, and it's an amazing thing. I've been through it 4 times now. There's so much emotion, there's so much you want to do, so much you want to say. Everybody you've ever met wants to congratulate you and come by and maybe bring you some food, hopefully, or do your laundry or something along those lines, but whatever it is, hopefully you've got a lot of support and a lot of great people to help you out in your life. But one of the things I want to talk about is why it's not a great idea to have your baby exposed to a lot of people right away. So a friend of mine is Ethiopian, and she told me in Ethiopia, when your baby's first born, you stay home for the first 40 days no matter what, and everybody just pretty much leaves you alone. We were talking about why that's great, because in terms of our world, when you think about newborn babies and how weak their immune systems are, isolating that baby for those first 40 days is a really good idea because it protects them and keeps them from getting exposed to infections. When your baby was inside you, he or she was getting all of your antibodies, all of your immunity and everything that the baby needed, and all of a sudden when the baby's born, that starts crashing before their system starts revving up. They start making their own immune system. So in that first 3 months, new babies have a very low immune system. It helps if you breastfeed. That gives you some of the immunoglobulins in the breast milk, but it's not always enough. And we generally consider babies in the first 3 months to be fairly immunocompromised. So what that means is when your baby gets a fever, it could mean that it's just a little virus and the, cold, common cold, runny nose, that type of thing. Or it could mean there's a serious bacterial infection there, like meningitis or sepsis or something along those lines. There's really no way for us to tell as doctors just by looking at the baby. The only way we can figure out what's going on is if we do something called a full septic workup. And what that means is we will do blood tests, which include a complete blood count and a blood culture. We would do urine tests and a urine culture, and then we would also do a spinal tap, and that would include cell counts and a culture. This is called a full septic workup, the combination of the 3, the blood, the urine, and the spinal tap. Then we admit the baby to the hospital for 2 days of IV antibiotics, and once those cultures can all come back clean, then we know the baby's safe and we can send you home. Any hospital you go to in the country, any baby under 30 days with a fever greater than 100.4 is going to get that workup. In the 2nd to the 3rd month of life, we can do what's called a partial sepsis workup, which is just the blood work and the urine test. And if those come back and look okay, we can send you home. But if they don't, and there's different standards, so there's a few different criteria people use, but most likely then they would either go on to do the next step, you have antibiotics and all of that, and you're kind of back in the same boat as the baby under 30 days. So in that 30 to 90 day window of life, there's a little more leeway, but you're still dealing with a sick baby who could potentially wind up in the hospital with IV antibiotics. That's kind of a big procedure for a brand new baby, and it's really hard sometimes for the new moms as well. I've never seen a mom go through this whole thing without crying. It's tough. It's hard for everybody. It's hard when you're trying to adjust to your new family to all of a sudden have to be back in the hospital. But there's a really good reason for it, and that is if your baby is septic, which there's a small chance of it, but if it's missed, that baby can die, and that would be a terrible tragedy to have something like that happen. So you have to go through this procedure if your baby has a fever. There have actually been cases where somebody said, no, I don't believe that my baby's sick. I think everybody's fine. And they went home and the baby did die. So I would really hate to see that happen, but I'd also hate to see just the baby get sick in the first place. That's why I believe it's better to keep the baby home. I tell moms, really try to limit exposure to other people. When my kids were born, I didn't let anyone in the house who hadn't had a flu shot updated and a pertussis updated recently. I didn't want to take the chance of my baby getting a life-threatening illness like that. And then I also just, with the first baby, it was easy. We were able to kind of isolate and cocoon ourselves. Didn't have that many issues. But when my second baby was born, I had an 18-month-old. And then when my third baby was born, I had a 3-year-old and a 20-month-old. And when the fourth baby was born, I don't even know. I had a 4-year-old, a 2-year-old, a 1-year-old. With each progressive child, my baby was exposed to more and more booger covered toddlers. I was scared for each of those times, but fortunately it worked out and nobody got sick. The other thing that was easier in the time of year, so my summer babies, I didn't have to worry as much about the flu and about RSV, whereas my winter babies, it was really tough. And somebody asked me, when are you due? And I said, April. And they said, oh, great, you'll be out of RSV season. Just because that's kind of how we think about things when we do this all the time. After my daughter was born, I know my husband had to go out of town for about a month, and I thought I was going to lose my mind. It was snowing every day. I couldn't even shovel the walk because I couldn't leave the two babies alone. I had wonderful neighbors who would come and do my sidewalks for me, but it didn't even matter. We didn't have to do the driveway because I wasn't going anywhere because I was just stuck in the house with two young babies. And I know how hard that was. You can do things like, if the weather's nice, you can get outside, go for walks, but just avoid crowds, avoid preschools and daycares and those kind of places. Avoid the little germ factories that are toddlers if you can. So just try to keep those other kids out of the baby's face. Try to kiss the toes instead of the face. If you have a family member who's coming and you know they're sick, just ask them not to hold the baby. Anybody who came in my house in the first 3 months, I would always have them wash their hands before they picked up the baby. I would also a lot of times just wrap the baby in a blanket, so that way when the person held them up on their chest, they're leaning on the blanket and not on the person's shirt or coat or whatever it was. Now again, you don't want to be hurting everybody's feelings because everybody's really excited to come see this baby, but in the most gentle way possible, try to explain, I'm really scared if the baby gets a fever, we'll wind up in the hospital, and I don't want to do that. Most people will understand, hopefully they will. And if not, it's your baby and you do what you think is right for the baby. I hope this was helpful. I hope this gives you a little ammunition, the argument that you need to make just to keep your baby safe in those first 3 months. And please comment below. Let me know what you think. Ask any questions. And I look forward to hearing from you. This is Dr. Lili with My Pocket Pediatrician. Thanks for coming by.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.